There's lots of evidence to suggest that police calls related to suicide and substance use and overdoses are up right now.
As we continue to go through this pandemic, it's difficult enough to deal with all the emotions and the stressors that are coming at us every day. But for people who already have existing conditions of depression, anxiety, or trauma, it's extremely difficult. Joining me now is Dr. Jeffrey Guina. He is the Chief Medical Officer at Easterseals, and he is a psychiatrist. Dr. Guina, it's good to see you.
Thanks for having me.
Why don't you go ahead and give people a sense of what Easterseals does and who you provide help for?
Easterseals has multiple clinics all over Michigan. We provide comprehensive mental health services. So we have psychiatric medical staff that can help you manage medications. We have case managers. We have therapists. We do home-based services. We have services in our clinic. Right now, we've transitioned a lot of those in-person services to telehealth. And that's been an interesting change, but it's been very important for helping everyone and helping our community.
Yeah, we've heard that from so many organizations who've had to transition like this. Now, there are 14 locations that you have across the state of Michigan. Give us a sense of population-wise, about how many thousands of people are you able to reach?
We last year, I believe we served over 13,000 people. We are serving thousands of people. It depends on each location. But it's interesting because despite everything that's going on right now, this year and the months since the pandemic, we've actually been serving more people than we did at the same time last year. And I think a lot of that is a testament to our staff's adaptability and flexibility in this difficult time, transitioning from in-person to doing mostly virtual services. And it's also speaks to the great need and the stress that's happening from both the pandemic and the stress from the shutdown itself, and people really needing help right now.
Can you give us a sense of some of the things that you're hearing, some of the issues that people are talking about?
Sure. I think loneliness is a big issue right now. People are isolated. There's financial stressors going on. Many people have been laid off or furloughed or terminated from their positions. There's lots of evidence to suggest that police calls related to suicide and substance use and overdoses are up right now. And so I think a lot of the coping skills people have, like going to the gym or going and seeing their friends or family, a lot of those have kind of been taken away from people during all this. And it makes it difficult to cope. And that's why it's so important that mental health services like at Easterseals are available for people and continue to be available and work around some of the issues associated with the physical distancing that's required during this time.
So when you had to change everything and bring everything online or connecting through a phone, what are you telling your therapists and what are they telling you about how well that's going with clients, and if that's enough? I mean, I think something is better than nothing, but what are some of the challenges or what are some of the positives that you're seeing from the telehealth?
You know, I think everybody is initially a little skeptical, especially if they haven't done it before. We had dozens of our staff that were doing telehealth services before. Now we have over 300 staff doing it. And so both from the individuals we served, there's been some nervousness about it, and from our staff. But I think once everyone kind of gets over the initial hump of using that technology, they notice that it can be just as helpful as in-person services, and a lot of times they forget that screen's even there.
We're hearing that mental health services are going to be needed now more than ever. I mean, you're obviously feeling it and seeing it right now, but in the year or even years to come, you know, there's a mental health hotline through the state of Michigan right now. What are you anticipating in terms of enough therapists, enough licensed people to be able to meet the need that we may be seeing coming out of this?
Yes, I think that was a concern even before the pandemic. There is a huge shortage of psychiatrists and mental health professionals statewide and nationwide. And I think that's why it's so important that we support training programs and education programs to increase the availability. But it's also why it's really important to find innovative ways of reaching the people in need, like using telehealth, like doing home-based services, like doing integrated care. And that's something that Easterseals has been working on even before all this, is really working with primary care physicians and doing telehealth services so that we can reach everybody.
What about services? And I know you've dealt extensively working with people with PTSD. What about some of your therapists and the people who are working at Easterseals and dealing with everything that they're taking in right now? It feels that we all need a little help somewhere along the line.
Yeah, so I think that's something that's really important is personal wellness, especially among healthcare staff, whether they're working in a hospital or where they're working in a clinic, um, helping people through their own trauma can often take a toll on the staff members themselves. And this is a stressful time for everyone. And I think it's really important that we're all taking care of each other, but also there's the analogy of you got to put your oxygen mask on first before you put the oxygen mask on someone else on the plane. And that can sometimes also be an important thing for healthcare workers to remember. Sometimes healthcare workers, we're so focused on helping other people, we forget about ourselves. And to be our best at helping others, we have to be mindful of ourselves as well.
Looking that we're about 7, 8 weeks into this pandemic and really a new way of living and a new way of existing, what would you say are some of the signs or things that families can be looking out for in loved ones or even in their immediate family that someone might be going into crisis, that someone is not at the end of their at the end of their limit, but really starting to feel the effects of this in a stressor way?
I think worry is a normal human emotion, right? We're all feeling it all the time. This is just enhancing that feeling. But if that worry gets so great that it's impacting your ability to meet your responsibilities, to fulfill your roles, whether that's a parent taking care of your children or a caregiver for maybe an elderly loved one, or if it's getting your work done, or if it's just taking care of yourself, your home, those sorts of responsibilities. If it's becoming so difficult to do those things, that's when I really start worrying that it's impairing your functioning. And that's when I think it's important to look into seeking support, whether it's from talking with loved ones or clergy or coming to get mental health treatment with a therapist or a psychiatrist like at Easterseals.
Give me a big picture view for you in terms of, you're the chief medical officer and you've got to make sure taking a look at 4 months out, 6 months out, what's the plan and how medicine is going to be changing, and kind of what your new normal will be in treating people. What are some of the bigger things that you're looking at down the road?
I think that's something everyone's thinking about right now, what the next normal is going to look like. And I think we're still getting the data and trying to figure out, what's going to happen with the pandemic, what's going to happen with the shutdown, how are services going to change in the future, in the near-term future and the long-term. I think there's a lot of unknowns still. We're trying to be flexible and plan ahead. We anticipate that as the shutdown rolls back kind of in a stepwise fashion, that we will start doing in-person services more and more in a similar stepwise fashion, but with increased precautions, especially to begin with, limiting the number of people in waiting rooms and maybe increasing the space of rooms so that people don't have to be so close together, wearing personal protective equipment, those sorts of things. And I imagine that as time goes on, some of those things will be able to be loosened, but it's hard to know exact timelines at this point. I think we're all kind of waiting to see what happens, and that unknown in itself creates a lot of stress. And
But you believe that telehealth is going to be here to stay.
For sure.
Yeah. Why don't you go ahead again and tell people if they feel that they need help, what should they do?
There are numerous suicide hotlines out there and help hotlines. There is 1-800-75-SEALS is the Easterseals number that you can call. And despite the increased need, I'm pleased to report that our wait time is down to 15 seconds. So I really encourage people to reach out that way. You can also go to easterseals.com/Michigan, and there is a free online mental health screening that you can take, and it also has information about the services we provide and contact information.
One of the things that I hope comes out of this is that we can talk more freely about mental health, because this is a shared experience that we are all feeling, and it's all affecting us in one way or another. And even if we haven't lost a loved one to this, there is still the stress and the pressures of existing in this new world, and it's okay to feel that way.
Absolutely. I think words can be powerful. And when we bottle things up, sometimes they can come out of us sideways. But if we can express what we're feeling with trusted loved ones, I think that can be really important. And I think along those lines, it's really important during this time that even though we're physically distancing from each other, I try to avoid the term social distancing, because we can be social just like you and I are being right now, even though we're physically distant. And I think it's really important to try to stay connected with each other. We're so used to doing texts and emails, but right now it might be extra important to do video communication with each other, or telephone, so you can hear each other's voices. And I think that can be really, really important, really powerful, and really healing.
Yeah, it's funny. Every time I do one of these Zoom interviews, and if I know the person, it's like, it's good to see your face. And I think it's, we take that for granted, that kind of connection is so very important.
Yes, for sure.
Okay, Dr. Jeffrey Guina from Easterseals, thank you so much for being with me. A lot of great information and very helpful for people. And thanks for all the work that you and your team are doing as well.
Thank you.
You can find more at onedetroitpbs.org, or subscribe to our social media channels and sign up for our One Detroit newsletter.